Okay, well look, so thanks everybody for coming, welcome, and it was great to see both how much interest there was in today's event and lovely to see how many of you came early so as not to miss out, so it's great that you're here. For those of you who don't know me, I'm the CEO of the Sachs Institute. We work to increase the use of research and policy, practice and service delivery. And it's my great pleasure to welcome you here today on behalf of both the Sachs Institute and our co-hosts, the NHMRC's 3 partnership centres. The Cognitive Decline Partnership Centre, and it's great Sue Curl, to have Sue Curl, the director, here with us this afternoon. I think this was the first NHMRC Partnership Centre. It's been a great model for all of us, and we've all learnt a lot from working with that centre, which has, I think, done some fantastic things. I think, unfortunately, Andrew Wilson from the Prevention Partnership Centre is not with us today, but I know there are many people from TAPS in the audience, and welcome. It's been really a privilege to be part of that Partnership Centre, which is, I think, doing some very exciting things. And the newest Partnership Centre, the Health System Sustainability Partnership Centre, which has really just started, I think, about a year ago. It's great to have Joe here with us and Joe Holt, and I think that we're expecting Jeffrey Braithwaite, who's the director of that centre. It's really been a great journey, the partnership centres, and I think we're grateful to NHMRC for going on the journey of the centres. So I'd like to start this afternoon really by acknowledging the traditional owners of the land we're meeting on today, the Gadigal people of the Eora Nation, and to pay my respects to elders past and present and to any Aboriginal people who are here with us today. And of course I'm really particularly pleased to welcome our 2 keynote speakers who I know are known to so many of you in the room, Professor Trisha Greenhalgh and Professor Anne Kelso. It's going to be, I'm sure, a very exciting meeting, and I'm looking forward to hearing their thoughts and insights on research impact and how we measure it. It's a really important issue for us, and one that I think, has been the subject of discussion both here in Australia and internationally. Again, I'd like to welcome all of the participants in this event, both those of you who are here and those of you who are joining this event through live streaming. I'm not quite sure where you are, but welcome, and we look forward to having you as active participants later on. Before we get started, there's some brief housekeeping details, so if you could just take this minute to switch your mobile phones to silent. And just to let you know, we're not anticipating any events, but if they happen, the evacuation points are at the back to the left out the door, and indeed that's where the toilets are too, so if you need them. So look, in getting started on this, I guess I wanted just to pay tribute really to Peter Will's review of health and medical research. So going back now a little while, nearly 20 years, but his report, The Virtuous Cycle, really was transformative, I think, in Australia because it really emphasised the importance of not just doing research, but that realising the potential of that research to impact on Australia, on economic issues, through commercialisation, on health policy, clinical care and service development. I think this report was really sort of seminal in stimulating thinking in NHMRC and other places to better focus on the impact of research. And, obviously the partnership centres have been a very exciting initiative in this respect. So maybe if I stand back, can you still hear me? I feel like I'm... So these partnership centres are unique, I think, because they try to establish a framework for a long-term partnership relationship that lets a different kind of working environment based around co-production develop between people who use research and people who do research. It's actually really exciting to see the 3 partnership centres coming together today to host this meeting. There's lots of learning, I think, from the past 5 or 6 years, and a great opportunity to share some of that. Obviously, research impact has been of interest more broadly. In Australia, we have the Excellence in Research for Australia, the ERA, and this is something that I know that all of the universities watch carefully and has some consideration of impact within it. I've been really interested to read Trisha's analysis of the Research Excellence Framework in the UK, and that's a kind of similar activity. I'm not sure if Trisha's going to talk about that today, but I've been really interested in her insights into that. And of course, if we think impact's important, we have to start by being able to measure it, and that's the focus of the discussion today. And I'm absolutely delighted that we've got two such fabulous leaders to talk to us about their thoughts in this respect. After their presentations, there'll be some time for reflection and discussion and questions, so I'd ask you to hold your questions till we come to after Anne's presentation. But right now, it's my pleasure to introduce Professor Trisha Greenhalgh from the University of Oxford. I think many people in this room would know Trish already. She's Professor of Primary Care, Health Sciences and Fellow of Green Templeton College at the University of Oxford. She's, for a long time, has worked across primary and secondary care and is interested in this from a social science and medicine perspective. She's been a leader in healthcare, often coming to Australia over many years, and I'm really delighted to welcome her back. Trish.
Great. Well, thank you very much, Sally. Thank you for inviting me. And these various people whose billboards, organisations whose billboards you see, have generously funded my trip, which was wonderful. It's funded a bit of my trip. I put out a tweet, actually, saying, come on, I don't want to fly economy all the way to Australia. Who would like to chip into my fare? And that's how I think this event got started, which is great. Acknowledging also, I've got on this front slide, Wilfred Meinhardt, who's a colleague of mine from Rotterdam, actually, who's made a couple of slides for me because he's got access to a piece of software which is relevant to something I'm going to say later. So I'm going to talk about measuring the impact of research, tensions, paradoxes, and lessons from the UK. The first thing to say is that this term impact is a bit of a loaded metaphor. It has a kind of Newtonian feel to it, doesn't it? It's sort of a physical impact thing. There's a strangeness about this word impact, I think. So why all the fuss? Well, as you've heard already, in the UK, we get exercised every few years with this thing called the Research Excellence Framework. I was on the panel in 2014, and I will be on one of the panels again in 2021, where a full 25% of the points, which means 25% of the money, will be allocated for the account of what is the impact of your research. So you can have as many papers as you like, but 25% of the money that you're going to get for the next 7 years is going to be on impact. This tends to focus the minds of vice-chancellors and heads of institutes. You can see various other, I won't read all these out, but impact features in so many things that are important to, universities and research councils. Individual academics are increasingly performance managed on impact, which I think in itself is quite interesting. But putting all that aside, there is also the moral issue that we who work in academia tend to be funded from the public purse, and we should be doing stuff that is in some way relevant to the society that keeps us in bread and butter. Now, impact has been theorized and empirically explored in a lot of different ways, and I don't know if you can see the colors. Maybe you can't see the color, it doesn't matter. I colored these in, I'm not going to read them all out. I doubt if anyone recognizes every single one of these, and probably some of you are thinking of, hey, why isn't my favorite impact theory or framework up there? There's lots of them. The first two I coloured in brown because they come from economics. The Buxton and Hannay payback framework, which is actually what inspired the REF impact case studies I'm going to tell you about. The next four, numbers 3, 4, 5, and 6, are more social sciencey. They're mostly qualitative type analytic lenses. And then 7 and 8 are the way, if you go into a school of business and management, for example, and you ask about how you measure research impact, they'll talk about the triple helix, or they'll talk about things like supply chains versus knowledge networks, all the rest of it. I'm not too sure about those ones. I feel most comfortable actually in the social science bit in the middle, but actually there's lots of different ways of skinning this cat. Now, a few years ago, along with some colleagues, I perhaps against my better judgment, decided to do a systematic review of different approaches to research impact. And in fact, the full report ran to about 200 pages, and then we summarized it in this paper in BMC Medicine, which is, a mere 5,000 or 6,000 words. And one of the things we looked at was the sort of philosophical underpinnings of different approaches to research impact. So if you're interested in the kind of the epistemology of knowledge and its and how it kind of gets into practice or not, then we unpacked a bit of that in here. But let me summarize to save you bothering to look at the paper. Pretty much all models of research impact, I think, embody 3 linked tensions. And the first tension is a tension between some kind of Newtonian logic, the idea that there is a linear cause and effect link between research here and impact there, versus a more complex system logic in which impact, the links between research and impact are seen as much more non-linear, emergent, and adaptive. And Sally's already alluded to that when she talks about the partnership programs, the prevention partnership, the cognitive decline partnership, and that kind of thing, that they are inherently non-linear in their approach to impact. The second tension is between impact metrics and impact narratives, and this is something that we talked a lot about in the REF, and that's quite a contemporary topic. To what extent can we just use, bibliometrics and stuff? I'm going to talk about that in a bit. And finally, impacts as outcomes, how many lives have you saved, versus impacts as processes and relationships. What are you doing? Okay, so you will know this pipeline picture or something like it. And we all kind of laugh at it and we roll our eyes at it and we think, we know it's not like that. You put the dollars in at the top and you kind of follow it through and out come the societal benefits. We know it's not like that, but on the other hand, we also find this metaphor useful sometimes. We talk about T0 and T1 and T2 and T3 translation. An example of Newtonian logic, and I think Steve Hannay, who would disagree with me here, is one of the co-authors of the payback framework, but I've argued this out with him, and I think he's lost. This is relatively Newtonian. So the payback framework means you fund a piece of research and then you follow it through and you get various kinds of payback. Please don't try to memorize this list. I can never remember what they are, but you can always look it up. It's probably got a Wikipedia page. These different kinds of impacts, of course, there are academic things and then there are other things that you can see listed there. The problem with using Newtonian logic was summed up by this wonderful quote back in 1939 by the amazing Abraham Flexner, the American academic, and he talks about the Mississippi River. It's always a good metaphor in America. But the idea that, the river meanders and the things flow into it and flow out of it. I drew this diagram to try and explain this. Look, those of you who've ever done any research, that grant application you write for study 1 is always going to be a pilot study, isn't it? And you anticipate that once you've done your pilot, you'll then go on and do study 2, which is the bigger version, the more refined version, study 1. And then you've got this impact that's going to happen when you've done your trial or whatever it is. But study 2 never happens Because what happens is some other team are doing another interesting piece of work. You think about your study, you go to a conference, you swap ideas, you start collaborating, and you put all sorts of effort into various things which take you absolutely nowhere. And then down here, you have some impact. You then draw an orange line back to study one so that it all makes sense, which is why the impact narrative can only ever be written retrospectively. But when that narrative is written retrospectively, it makes the impact seem linear, and that then reinforces the payback framework people saying, well, there you go, it was linear all along. Nevertheless, from the forward direction, that's why it's so hard for you to say what the impact is actually going to be. Sorry, I'm rushing on. I have a horrible feeling I've pre-programmed a set of timings into these slides, so they may jump forward, but hey, it doesn't matter, we can go back. The complex system logic of impact, of course, needs a more complex looking diagram. And here's one that looks like a kind of plate of spaghetti with the spaghetti having fallen off the edges. But look, it doesn't really matter. The idea is that a lot of stuff is happening, and what they've put in the middle here, this is Joe Rycroft Malone's work. I like this work a lot. The context of collective action. And then you can see all this stuff in the middle that's important, like governance and connectivity and motivation and resources and facilitation. There we go. These things have to be aligned, and those of you who do this work know what I mean. And then there's all sorts of stuff about evaluating what you're doing and reviewing and reflecting and all that kind of thing. And in the end, you get some impacts over time. So this is much messier, and this actually is a realist model. I mean, it doesn't really matter whether you use a realist model or not, but I'm just showing you this is one model of research impact. The other one I really like, and Sally's going to be embarrassed by this, but I like this, the Spirit Action Framework. Those of you who are not familiar with it, on top is a great big pie, with a tiny little slice of the pie being research. Now that pie is everything that influences policy. And those of you who work in a university will think, well, guess what? Research really ought to be a much bigger slice of the pie. If you work in a university, you think that. If you work in policy, you know that there's all these other things that are tugging away, influencing policy. If you go down to the rectangles, I mean, this is not my work, so I'm not going to explain it in detail, but one of the things I love about this is the idea that you have to build capacity to want research, to understand research, to distinguish good research from bad research or irrelevant research, and then you have to get people to engage with the research. And that fourth rectangle along, which has got all sorts of messy stuff, suggests that even when people understand research, they may not use it in the way the researchers intended, which is perhaps the instrumental way. They often use it in slightly more subtle ways to kind of enlighten people and all that kind of thing. And in the end, hopefully you get some impact. So that's just another example of a complex system approach to impact. The UK Research Council's got a great diagram. Don't worry about the black writing, it doesn't really matter. The orange stuff is academic impact. That means impact that affects people who work in the university sector. And actually, the orange stuff is becoming less significant to the research councils than the green stuff, which is the societal impacts. And because they put the writing too small, I'm really pleased that Universities UK, which is another a university body in the UK, which is all the heads of all the universities, they've come up with 9 different kinds of societal impact. So this is the green stuff sorted out in a different way. And you can see that one of those is health, but there's plenty of other different ways in which research can impact on society. I very much like this quote from the London School of Economics Impact Handbook. it says a research impact is a recorded or otherwise auditable occasion of influence from academic research on another actor or organisation. So that means what we're doing at the moment is impact, because it's an occasion of influence. You know, we'll all have drinks afterwards and we'll influence one another. It's not the same thing as a change in outputs or activities. Now, this is quite important, because if you're a Newtonian, if you're in the Newtonian school of impact, so nothing really matters unless you saved some lives right down the end. Actually, in a complex system, the question is what contributes? And the things that contribute, as I think you all know, are the bringing people together for conversation. So those briefing breakfasts, you know, the blogs that you're writing, all those kind of things that in the narrow sense are not academic outputs, those are absolutely crucial occasions of influence. So how do you know whether a piece of research has had or is going to have societal impact? And the European Horizon 2020 programme says you can look at that in two ways. You can look at it ex post, in other words, after you've done a piece of research, and I've done EU-funded research, I can tell you what happens is they keep emailing you for years and years afterwards saying, well, come on then, what's happened now? You know, how many lives have been saved now, or how many researchers have now got tenured posts or whatever. And you have to fill those out. But you can also assess ex ante whether something is likely to have impact. What's your track record in having impact from previous studies? Do you have well-constructed dissemination plans? In other words, is dissemination on the agenda from day one of the grant, not, you know, towards the end of it? Is the project embedded in stakeholder networks? Of course, if it's sitting in a partnership, it's more likely to be. And in particular, is there early involvement of policymakers? And this checklist from the Canadian Health Services Research Foundation, it's a great question. And when you're filling in your grant application and you come across a question like, are relevant decision makers part of the research team as investigators or with a significant advisory role? You think, why the hell are they asking me that? And the answer is because research shows that if you've got the policymakers on board right from the beginning, they're on your steering group and they're having dialogue, they're going to be pretty hungry for those findings. But it's also more likely that you are addressing a question that the policymaker thinks is important and relevant in a way that they can get their heads around. All right, let's talk a little bit about the about impact narratives as exemplified by research excellence framework impact case studies. We have not finally decided how this is going to play out in the 2021 ref, but I'd be very surprised if it's significantly different from this. So this was a slide I made years ago when I was working at Queen Mary University in London to encourage people to write these in a particular way. One of my other research interests is narrative. How do you tell a story? So the story goes like this. There was a problem, and we in this university did research to solve the problem. The problem got solved, that's what was called significance, and the benefits spread a long way. So if it was something that could have global relevance, you should demonstrate that people outside your own country were taking up the research. So here's an example. This was one that I wrote for a colleague, Nick Wald, who developed a better set of tests for detecting Down syndrome prenatally. So the story we ended up telling was that before he started his work in 1993, most babies born with Down syndrome were a surprise. The parents didn't know they were expecting Down's baby, and his tests greatly increased the accuracy of prediction, to the extent that Down's babies are now almost always born out of choice. The mum decides not to have the test, or she decides to have the test and not have a termination but be forewarned, or she decides to have a termination. And they now use our tests in China. I looked for where else Nick Wald's tests got used, and we were able to say far and wide, but particularly China, because there's so many people in China. So we were able to demonstrate significance, reach, attribution. In other words, the impact was attributed to the research and the relevant timescale for the ref. One of the things I did while I was on the ref panel last time, I did what was effectively an audit of all the impact case studies from one sub-panel of the ref. And this was not a very sophisticated piece of work. It was just a counting exercise. It took me a while, but that's what Sundays are for. These were the kinds of impact that were described in those 162 case studies. By far the commonest, in 120 out of 162, so 3/4 of them, they influenced a guideline. In the next commonest thing was influencing some change in policy other than a guideline, change in clinical or public health practice. Yeah, that happened in more than half, and so on. Very few actually demonstrated saving any lives. Most of these impacts were pretty proximal. There we go, we're in paragraph 23B of such and such a guideline. So the mechanism described in these impact case studies, you can see it here, but far and away the commonest mechanism was strong and ongoing links with policymakers. Most commonly, the principal investigator was sitting on a national committee which was deciding policy on a particular issue. And you can see 2 down, 3 down, membership of a guideline development group, usually a nice guideline group. So if you're on those groups, your research is going to be more likely to get into policy. Knowledge translation means taking your research and turning it into something which is explicitly, for example, a policy brief or an infographic or something like that. Actually, not very many people did that. Fewer than a quarter did that. And about a quarter of people in their impact case studies described no active engagement activities at all, which is quite interesting, really. They've got this pipeline model, and they don't quite realise that it would be a good idea to say what they actively did. I think that'll change next time, partly because we published this paper, not quite naming and shaming, but suggesting that people might want to apply the evidence on how to achieve impact. But this policymaker link is particularly important. What did the impact case studies measure? As I say, mostly short-term direct and surrogate impacts, such as one sentence in the guideline. Most of these were from randomized controlled trials or meta-analyses. Only a tiny proportion had said anything about patient-relevant outcomes. What I would call complex system research, in other words, research that isn't kind of isolated out experiments, so natural experiments, community-based staff policy analysis, that kind of thing, hardly featured, despite the fact that many of the departments submitting to that sub-panel did plenty of that kind of research. They just made the cut and said the only stuff we're going to submit is our experimental RCT work and evidence for getting into a guideline. I hope that is going to change next time. And in fact, that's the reason why I applied to be on the panel, because I think this is problematic for reasons that I'm sure you realise. Now, this paper from Hughes and Martin back in 2012, I love this diagram. This is why I think people get drawn into reporting on short-term impacts. The top line is a time scale from 0 to 25 years, and the thick blue line that goes down is the ease of attribution. In other words, if you've only done research last year and it's changed something this year, that's quite easy to show. It's much harder to say research 20 years ago has caused this. But look at the red line. The red line is the effect of complementary assets. What does complementary assets mean? It means as I run a program of research over 25 years, I get to be on first name terms with particular policymakers. I've got their mobile numbers and their email addresses. I go to London from time to time and have breakfast with them. If they want someone to comment on something, they think, oh yeah, I know Trish, etc., etc. All those complementary assets, they're quite subtle, but that's why the new kid on the block who's just coming in and getting their first research grant does not have those contacts, and it's harder. Now, the longer you go from a piece of research, likely the more senior you are, the better connected you are, but the higher your complementary assets. And at the moment, what it looks like is that the way we are measuring research impact in the REF is privileging ease of attribution over the effect of complementary assets. And that's problematic for certain types of research. And I'm hoping to do something about it in the next REF. All right, let's talk about metrics. I bet there's some geeks in the audience. I am not one, but I've explored some metrics for the purposes of this talk. The first thing to say about any impact metrics is, are you clear about the unit of analysis? So the unit of analysis can be the journal, it can be the paper, it can be the individual, it can be the institution, and it can be probably other things as well. But people get really confused about this, and so they say things like, well, I've got a paper in the Lancet's impact factor is this, therefore I'm really good. But no, that impact factor is the Lancet. If you're measuring yourself, what's your H index? Or if you want to look at your paper, has your paper been cited, etc.? You get the idea. There's two principles with impact metrics, and I'm not opposed to impact metrics, but let's remember garbage in, garbage out, and let's remember Goodhart's law of economics. When a measure becomes a target, it ceases to be a pure measure because it leads to gaming. And I'm sure you get what that is. Well, now look, this is the bit where I'm thanking Wilfred Meinhardt, who's got a piece of software that can compare different universities with different metrics. So these are institutional level metrics, and down the left-hand column you can see various different metrics. I have no idea what they are. I know that THE stands for Times Higher Education, and I know the guy who puts those together, and he's very geeky and he kind of adds up this and adds up that. They're all composite metrics. Now, you can see in the top right there is a scale, and green is at the top. So if you're in the green, you're doing really well in the ranking. If you're black, you're not doing so well. And you can see here that some universities do really well against all these different metrics. Some, however, score well against some metrics and badly against others. So the fact that there's a league table and your institution is first, second, or third doesn't necessarily mean it's better in everything. It may be really good for one thing and not so good for another. Here's another slide that Wilfred made me because I said I was coming here. This is how many academic topics is the University of Sydney publishing any papers in, and you can see this beautiful rainbow, kaleidoscope picture. University of Sydney publishes in almost every academic topic known to man. But now if you look at the right-hand picture, you can see these are the topics where anybody from the University of Sydney gets into the top 1% by prominence, and it's much less. So if you looked at those and you say, well, where are we really strong versus where are we less strong? But this was the one I found most interesting, which is this University of Oxford on the left. Sydney is punching at least at the weight of the University of Oxford in most of its top topics. So I thought you'd be pleased to see that. And I'm only giving you this just to illustrate the kind of pretty pictures, but also when you see this, the academics among you will immediately say, but what about this and what about that and all the rest of it. And I'm sure you'll be firing questions at me afterwards that I can't answer. I couldn't find a listing of what we call spin-outs and startups for Australian universities. So I've given you one that I had previously. It's not just because my university is at the top of it. This is becoming something really key, and certainly one of the big grants that I hold. We are performance managed on number of spin-outs and startups. In other words, if we want more money in 4 years' time, we better make sure that we perform well on these metrics. And this is, of course, linked in the UK to the idea that innovation is going to, in health and medical fields, is going to do two things. It's going to generate health, in other words, going to make people better, keep them alive, all that kind of thing. But it's also going to generate wealth by improving the economy, particularly the regional economy. We're going to create highly skilled jobs, and we're going to do all sorts of exciting things. And this idea that health and wealth are joined at the hip and linked to this kind of metric is something that something I'm writing a paper about, actually, but that's another story. All right. I wanted to talk a little bit about the perverse incentives of metrics. So, for example, if the metric is academic publications, the reason why we think that's a good idea is to improve productivity of researchers. But what actually happens, of course, if you measure someone on the number of publications, they're going to slice their work into bits of salami, and this has been systematically demonstrated. We are going to get stuff that's methodologically less good, and also the quality of peer review goes down, etc., etc. We have to be a bit careful about this. You will be glad to hear that a number of groups, not just academic groups worldwide, are part of what I might call the responsible turn in research, where there have been various manifestos saying, hang on a minute, should we be allowing these metrics to rule our lives? Are the metrics a tool that we use, or are they the stick that everyone beats us with? I particularly like the Leiden Manifesto for Research Metrics, which asks people to stand back and question the metrics. I'm not saying we shouldn't use them, but they have to be used responsibly. I'm not going to talk to you about that one. So, when we're talking about research impact, we have to rise above this metrics game, but we also have to recognize that the metrics are not going to go away. So here's my suggestion. If you run a university, or if you run a research group, or even if as an individual you'd like to make sure that you are addressing that moral purpose of research impact, take a strategic approach. Ask, what is our mission, our institutional mission, our research unit's mission, whatever? What is our moral narrative? What is it that we would say is good for us to do? And then, what kind of impact resonates with this mission? Are we more interested in academic impact, or more interested in societal? Academic impact isn't bad, but we still want philosophers, don't we? I mean, it doesn't necessarily have to save everyone's lives all the time. But also we need to think about what kind of societal impact. We need to think about, do we want to focus locally or regionally, or are we the kind of institution that wants to address all those big global challenges? Are we interested in short or long-term impact, or what's the balance? Am I, as an individual, more interested in my moral purpose, or am I going to be contributing to the University of Oxford's moral purpose? What kind of dialogue am I, as an academic, going to have with my institution? And this question of, I've called it developing individuals or bringing in money. Look, the problem with some of these metrics is they drive us to eat our young if we're not careful. In the last Research Excellence Framework, every academic who'd already got their PhD had to submit at least one paper or risk not being returned, which was a great personal shame. And so there was a gun to the heads of the young, vulnerable researchers who really should have just been writing up their PhD. That's what they should have been doing. And you know, if it was a pretty solid paper, that should be fine. They shouldn't need to have to produce world-leading research at that tender stage in their development. The proportion of PhD graduates who end up as professors is about 2%. You know, we have a very high level of attrition. And one of the things that concerns me hugely is that we must keep that nurturing environment for young researchers so that they can develop and have the confidence to bring their ideas through and all that kind of thing. So I think there is that whole business of the impact metrics for young researchers has got to take account of you know, the extent to which we're prepared to eat our young to go up the league tables. And then the question of let's explicitly take on and or reject particular metrics so that becomes a strategic decision rather than simply looking at that picture saying, oh my goodness, we're not in the green, we're only in the orange, how are we going to get into the green? Hang on a minute, what does that green bit measure? That's the question we need to ask. So, okay, I hope you're all on Twitter, because I love Twitter. You can see here, Twitter, even the Lego academics are tweeting about impact. Okay, there's my Twitter handle. So, that's the end of mine. Am I on time? Pretty much. Okay.
Trish, thank you so much for that. That was a really fantastic talk, and I think really stimulating. I'm sure when we come to the discussion session, people will have lots of questions for you. But before we do that, it's now my really great pleasure to welcome Professor Anne Kelso, who's the CEO of NHMRC. Before joining NHMRC, Anne had a really distinguished career, including being director of the WHO Collaborating Centre for Influenza at the Doherty Institute in Melbourne. So she's had a very broad scan in her career across many kinds of research. And I've been, you know, really impressed by all of the things that are changing and developing at NHMRC. So join me in welcoming Anne.
Well, thanks very much, Sally, and it's such a privilege to be part of this terrific event and to have heard Trisha's really inspiring and very sophisticated analysis of impact. And so I think now this is the opposite of the warm-up talk. This is the cool-down talk before we all get to have a drink and have a talk about Trisha's wonderful presentation. And so, of course, we're nowhere near the level that I think Trisha's just described in thinking about research impact at NHMRC, but we are nevertheless thinking about it, and I want to talk to you today a little bit about that. Thank you. So to start with, just for background, and I think probably just about everybody in the audience here will be very familiar with NHMRC's position in the spectrum of health and medical research in Australia as the Australian government's peak body for funding health and medical research. But we do a great deal more than that, and it seems to me when I think about NHMRC's roles, they are diverse, but they're all really pulled together by evidence. And so NHMRC, through research funding, supports the generation of evidence, but it also supports the analysis and translation of evidence through the production and the endorsement of high-quality clinical and public health and environmental health guidelines. And as you'll be familiar with, we're also responsible for the Australian Code for the Responsible Conduct of Research and ethical guidelines for all human research and animal research in collaboration with the Australian Research Council. And then we also put out statements of various kinds, which sometimes get us into trouble, but they are evidence-based. And we also have a number of policies, such as on open access and data sharing, which are highly relevant to this question of high-quality evidence. So that's really a background to what I want to talk about. And as Trisha's already said so clearly, we do have a responsibility to the community and to the government who provide the funding for what we do. And I think when we think about NHMRC's role, then we must never lose the sight of our need to meet public expectations if we want to go on being able to support health and medical research and do all the other activities that we and you do. So as consumers of the health system ourselves, I think we, like the rest of the community, want our own health problems to be solved, and we need to keep an eye on that. And of course, we also want the money that we all pay in tax to be used well. And then again, as Trish has said, when you look through a government lens, of course the government wants those things as well, but they also have an eye on the economy, and so they want to see innovation, they want to see new businesses, jobs, exports, and they want to see a reduction in the costs of healthcare for society overall. So it is important that we think about those two somewhat different perspectives on what we are here for, either at NHMRC funding research or for you doing research with government support. So both community and government expect a return, and we hope and we must show a positive impact if we do want to continue to receive that support. So I want to talk about three things, and I want to use a very general term, explanation, definition for impact, the demonstrable benefits emerging from research adoption, adaptation or use to inform further research. And so I want to talk a little bit about how we're thinking about measuring the impact of NHMRC funded research overall. Then, in what will probably be of most interest to the applicants in the room, impact as a criterion for track record assessment in the new grant program, which will roll out from the end of this year. And then finally, just a couple of words about the impact of NHMRC health guidelines. So, first of all, the impact of NHMRC funded research, and here we can think about how we measure it, but also how we communicate it, because it's so important that we are communicating what we do, not just able to demonstrate to each other that we're doing something important. So if we think about measurement, then of course bibliometrics are the starting point, the traditional point that Trisha's just so elegantly described. But also increasingly now we can turn to data analytics. I want to say a little bit about what we're doing. And then within NHMRC over the next year or so, and with the help of our Health Translation Advisory Committee, we will develop an impact measurement framework, but that's at too early a stage to be able to talk to you about today. But say a little bit about bibliometrics and data analytics, and then a little bit about communication. So we've been doing the bibliometrics for some time and occasionally publishing a report called Measuring Up. The next report is really held up entirely on my desk and will be published quite soon. But the older one, Measuring Up 2013, has been on our website for some time. And so this is just a routine bibliometric analysis of all publications worldwide that cite NHMRC as a funding source compared with other Australian research publications and other worldwide research publications. And so we do all the measurements that you would expect, and the high-level ones are the numbers of publications, relative citation impact, level of collaboration. But then we look at that by type of research, by type of institution, and various other parameters. And the latest report, when you get to see it, will show, as we've seen in the past, rising numbers of papers, rising relative citation impact such that NHMRC-funded papers are cited at 1.68 times the world average, so that's great. And 42% of them involve international collaboration, which is also great. So these are useful measures, I think, of the most proximal stage of impact. They are important, but of course they're not the type of impact that government or the community is looking for, or that many of us are looking for from NHMRC funded research. So then we turn to data analytics and what we can learn from what we fund about the impact of NHMRC funded research. And I hope you can see this clearly enough, but there'll probably be a few people in the room like me who remember that to put in a project grant application you needed to send in 13 hard copy printouts, and which we'd all sort of hand typed basically on typewriters to fill in the forms. And as this picture shows, the very idea that you'd be able to analyse what was in those applications now would be, was obviously couldn't be done. So now we have the Research Grant Management System, which I know is loved by so many of you. And it is in fact very, very powerful, has a huge amount of data in it, and we're beginning to be able to use that for quite sophisticated analytics. But I think everybody here knows that will perhaps appreciate this. You know you've been working too long on NHMRC grants when you know how to use RGMS. And so we know that not only is this a really horrible program for the user, whether you're an applicant or you're a peer reviewer, it doesn't have the full power of data analytics that's available to us today, and which will develop, of course, much more intensively over the next couple of years. And so we're now, and I don't know whether you'll be pleased or shocked to know that at the same time as rolling out the new grant program this year, we're also rolling out a replacement for RGMS. And it's this picture here, which is a bit like a city in a cloud, because it is a cloud-based system, has a whole series of components which will give us tremendous power. And so that will start to roll out this year. It's replacing RGMS in time for the new grant program, so that when you apply for grants in the new grant program from the end of this year and early next year, you will, I hope, be using the new grant management system. And this is being developed in an iterative way with a really fantastic reference group of researchers and people from research admin offices around the country. It's got a really beautiful user interface, which I think you'll enjoy. Jeffrey Braithwaite saw a demonstration of it the other day and speculated that he might like to spend his weekends playing around with it, putting in shadow applications, so that sounded pretty good. But as you know, we don't let people put many applications in the new system, so he'll have to just do that for fun. But it is a nice interface. Now, the RGMS data will all be transferred over. You'll also be relieved to hear. But I think the power here is not just a nicer way to submit and to peer review grants. It's what we're going to be able to do by hooking up the data that you all put into RGMS with other sources of data to be able to much more powerfully understand the impact and outcomes of the research that we fund. There's some work being done on an app which had a proof of principle project done in 2016 with the developer Semantic Sciences, which looked for IP connections to NHMRC funded research through RGMS and identified about 1,300 patents and was able to validate many of those, but also was able to look at external patent databases worldwide and discover another 1,100 or more patents which have a connection to NHMRC grant funding. It was also then able to take a random sample of these packages of IP and show that the commercialisation income from them so far, with the information that could be extracted and scraped and collected through data linkage, was more than 800 million. So you begin to see, even with this just proof of principle analysis, how we can begin to understand much more strongly for different types of research outcome how we are going. So then that takes us just briefly to communication, because I do think it's very important that we talk to the world and to our community and our politicians about the outcomes of NHMRC funded research or MRFF funded research or any other publicly funded research. It's incredibly important that we tell the stories. So we've been putting a lot of effort into that over the last year or so with our website In Focus that has quite a lot of very nice stories on it now, and will be an important part of the new and much more attractive and usable website that we'll also be rolling out quite soon. We're using social media a lot more to tell the stories. We've had the 10 of the best publication every year for quite some time now, where we, based on final reports that people put in on their grants, we identify 10 really interesting and important stories to advertise and promote. We have the Research Excellence Awards for the top-ranked applicant or project in each of our funding schemes each year. And of course we have the Minister spruiking for us with grants announcements and the various other public presentations that we do. So in various ways we're trying to communicate the impact of research through stories in a way that I hope in the longer term we'll be able to complement with a much more sophisticated analytic approach. Now, probably the most important thing I'm going to tell you about today is something that's not been formally announced yet and is still a bit of work in progress, but it's a very important signpost to what's coming, and that is the use of impact as a criterion in track record assessment for NHMRC funding. And when we think about impact of the research of the individual, well then we start with the fact that the goal of all NHMRC research funding is the improvement of human health, so that is the ultimate impact. But we also know, because of the very broad spectrum of research that we support through NHMRC, quite deliberately, from discovery research all the way through various sorts of clinical research, public health, health services research, that, as Trish has also talked about really beautifully, that impact may be indirect, it may be very difficult to attribute, and it will invariably take time, and probably the bigger the impact and particularly the further its distance from discovery at one end, well, that time can indeed be 15 to 25 years. So it's a very big challenge, and when we think about how to do this, we're going to have a very flexible framework that doesn't attempt to compare individuals at one part of that spectrum directly with another. So we have to find a way to have that kind of flexibility in the framework. And I think then the other point that's on this slide is that because most of the research we fund is through investigator-initiated grants, it's really you as the applicant who are deciding what that impact might be in the future. It's not NHMRC saying we are looking for this particular impact and that's what we're going to measure you against. So we also have to think about that huge diversity of the type of impact that we might hope for and expect from NHMRC funded research. Now, those who are planning to apply for our future funding will be very familiar, I think, with the fact that we have 4 streams, of which 3 of them are new and replacing existing schemes, the investigator grants, synergy grants and ideas grants. The 4th stream includes a new separate scheme for funding clinical trials and cohort studies. And there's lots of information on the website, and the funding rules for the new schemes will come out a little bit later in the year. They're being finalised now. It would have to go through government approvals before they can be released for everybody to start thinking about their next applications. But it's important to note for what I'm about to say that the assessment criteria for the investigator grants and the synergy grants will have a big emphasis on track record, and that's where most of what I now want to say applies. And so we've been going through a process of seeking feedback from the sector on how to do peer review for the new schemes, and we have formed 3 advisory groups, one of which was specifically on track record, which has now presented its report to me. And we had a great discussion about it at Research Committee a couple of days ago, just at the end of last week. Now, this track record working group has put forward a framework for assessment, which has not yet been formally accepted by NHMRC, but we will use this framework in some form, and so the detail now is about how we actually turn that into a set of category descriptors for peer review, and therefore for you to think about in writing your material in applying for these grants in the future. So as you can see, this framework is proposed to have 3 components: publications, meaning academic outputs rather than grey literature, research impact and leadership. And the investigator grants are for people from every stage, from immediately postdoctoral all the way through to the most senior investigators. And so however we think about these 3 components, they have to compare like with like. Of course, you can't expect to compare a postdoctoral researcher with a senior researcher. So whatever we do here has to accommodate that career stage diversity as well. Now, the Track Record Working Group was very keen that we should use metrics for publications, and so that's a very active discussion, and it won't be rolled out in the first year, but we will do some form of trial on this as we move towards thinking about what will be the most appropriate bibliometric indicators to use to support the publication component of the track record assessment. But of course, I mostly want to talk about research impact, but there'll be this third component, which is leadership, given the nature of the people that we want to support through the investigator grant scheme, just as through current fellowships. So the research impact is very deliberately being considered in 4 streams: knowledge, health, economic and social. And the types of indicators that the Track Record Assessment Working Group proposed are shown here. And so if we think about knowledge, this is really, again, very much aligning with what Trisha's just told us. It's about the reach and the influence of knowledge. It's not as simple as I've published these papers and I have this many citations, although citations might sometimes be part of that argument. It's really about the influence on the field and how your research has led to some further development of research. And of course, that's depends on your career stage, exactly how much you would expect of that and how much could actually be demonstrated. But the health outcomes, economic outcomes, social outcomes, all of these are ones that are, I think, easy to understand, if not always easy to demonstrate. Now, the approach that the working group recommends to us is a case study approach for research impact, and perhaps up to 3 case studies per person. You could choose to just have 1, or you could choose to have 3. You could have 1 in knowledge and 2 in health if you liked, or you could probably have all sorts of variations on that theme. But that's the recommendation of the working group, and as I said, not yet formally accepted by NHMRC or converted into something that's actual guidance to researchers. But I think these are the sorts of things we're thinking about, and I think today's discussion is extremely helpful from that point of view. So this is a framework that's particularly under consideration for the investigator and synergy grants, because these have a primary track record component, whereas the ideas grants won't have a formal track record component. They will consider track record only in the context of the feasibility of the proposal. Very importantly, I think it shifts the focus towards outcomes and away from inputs. And one input that we specifically do not want to pay attention to in the future is the number of grants you've received, because this is just another input, and we're now about to make it harder for you to hold more NHMRC grants, so we don't want to have everybody saying, but how can I ever show my track record if you won't let me apply for more grants? So we really are quite deliberately wanting to move the attention towards outputs and outcomes and away from inputs that are not the sorts of things that you could explain to the community or the government as being useful things to have come from your research funding so far. As I've said, research impact criterion will be addressed through case studies, and we'll need to learn how to do that over time. I'm sure this will be a process of evolution. And there are quite a few issues to consider here. The relative weightings of the publication's impact and leadership criteria. We had a good discussion about that with the research committee last week. The time period for each criterion, and particularly if you think about impact, it's arguable that you want a whole of career consideration of impact, but you wouldn't want something that meant you were now funding somebody only because they did some fantastic work 30 years ago and they've done nothing since. So you have to take a balanced view of this, but in considering the impact of research over a career, then whole of career may be appropriate. As I've said, we are considering how to trial the use of metrics before publications, and the guidance for peer reviewers here is going to be really crucial, because this is a bit different from what we've done up till now. So now just a couple of words about impact of NHMRC guidelines, because this is a very important activity. It's the guidelines that we and many others around the country produce are an important pathway for translation of evidence into better clinical practice and public health. A lot of people put a lot of effort into these every year. We know from a report from 2014 that there were more than 1,000 guidelines produced in Australia by more than 130 developers in the years 2005 to 2013. NHMRC either produces or endorses a very small proportion of those, but we set a very high standard, and so it's a useful barrier, threshold that people need to get through to have their guidance, their guidelines approved by NHMRC. But we're now really interested to understand more about this. We've tried to promote guideline implementation and dissemination through our own standards for guidelines, but we recognise that overall there hasn't been all that much attention paid in Australia, with some exceptions, to the impact of these guidelines on patient and population outcomes, or on waste and variation in clinical practice. So we're planning a project again under the oversight of our Health Translation Advisory Committee over the next couple of years, to look at whether we can measure the impact of the guidelines, particularly the ones, of course, that NHMRC is involved in, so that we can learn more about how to improve their uptake. So that will be an ongoing story. So in summary then, as we've discussed, we think the community and the government expect something from us, from the public investment in NHMRC research or any other publicly funded research. We must show its impact. We hope that that's positive impact. We're building our data analytic capability at NHMRC and increasing the use of media so that we can both measure and communicate the impact of NHMRC funded research. We are letting you know that impact's going to be an important part of track record assessment in the new grant program. And we also want to do this work on measuring the impact of our health guidelines. So just to finish up with a slide where you may not be able to see the text at the bottom, it says, my question is, are we making an impact, as the dogs howl at the moon? And I think the very first question for us is to ask the question, are we making an impact, and how do we measure that? And I think the very fact that we're asking that question is a really important first step, which is wonderfully supported by this discussion today. I do think that our decision to have impact as part of the measurement of track record in a much more explicit and developed and over time, I hope, well-articulated way is going to have an impact in turn on researchers and how they think about the research that they plan. We want to see people thinking about impact in the original design and in the selection of collaborators and in the discussions they have as they plan and as they do their research, not just as a post hoc thought. But I think also introducing more consideration of the measurement of research impact will also change how we think within NHMRC about what we do and how we can foster translation into impact through our policies and through the nature and design of our funding schemes. So I think this is a very important time, and I look forward to the discussion now. So thank you very much.
Thanks, Anne, and thanks, Trish. They were both fantastic presentations. I have to say that now's a bit of a terrible moment because we're going to have discussion and questions, but I've got this very techie thing here for those of you who are here by web, which I'm hoping is going to work to see some questions come up here as well. So for those of you who are here in the audience, we've got 2 roving mics, I think. And do we have a mic up here for... We've got... Hello. All right. Questions from the audience? Well, Professor Nutmean, why am I not surprised? Here, thank you. We'll start here, that's great.
Thanks very much. Don Nutmean from Sachs Institute, University of Sydney. I was supposed to be the safety net, not the person you turned to, Sally. If I put my hand up, I was expecting others to. I wanted to ask 2 great presentations, by the way. Thank you, very complimentary and really stimulating. Speaking as someone with a modest research career, characterised mainly by heroic failure, I wonder whether we, by default, drift into a rather determinist discussion when we talk about research impact. I would say that some of my ultimately my most influential research has proved that some things don't work. And I'll give you an example. I did some work in the late 1980s, early 90s that I think proved beyond any reasonable doubt that interventions in schools to reduce smoking among children don't work in the absence of other measures. And the Conservative government of the day took that as a cue that we needed more and better interventions in schools because they couldn't countenance taking any other measures. And a later Labour government interpreted that as evidence that we needed additional measures. I think the point I'm making is that it was a heroic failure. And I regularly encounter in my work with early career researchers this strong desire to prove that what they're doing worked, which leads to publication bias and so on. So I just wonder, how do we guard against that drive to prove things that things work, and how do we capture heroic failure in a positive and meaningful way when we're looking at impact?
It's a great question.
Yeah, I agree. Really great question. One of the things that happened when I was on the medicine ref panel last time, this came up. The idea that your research is going to have a lot more impact if you're telling policymakers what they want to hear than if you're not. And I personally have been in that situation with research that I felt that we'd done a pretty good piece of research, and I was told by the department, the Connecting for Health people at, in the UK, who are a sort of policy-making body, if we don't like your report that comes out tomorrow, we're going to trash it. And I didn't like it, and they did trash it, and hey, hang on a minute, that wasn't my fault, that you didn't take any notice of it, etc. In fact, actually, the report had a lot of impact years later when someone else took over. Anyway, the point was, when we were on the ref panel, we said we can't create a perverse incentive for researchers to do the kind of research that tells policymakers what they want to hear. And the way we got around that was to say that each institution has to produce a certain number of impact case studies, but that number should be a lot fewer than the number of research programs that is being. So I don't know, last time it was one impact case study per 15 published papers that were being submitted, or something like that. And what that means is that right now there's a competition in my department for people saying, well, I've got a good impact case study, and someone else saying, I've got a good one. Actually, only about 2 are going to go forward. Most of our impact case studies will end up on the cutting room floor. And it's very rare, I think, for a university not to have enough. What that means is we're not going to penalise you for, because it's not failed research, it's failed impact, because somehow, if you think of Kingdon's policy streams and the primordial soup of, potential policies, if you're not floating in the right bit of that primordial soup, they're not going to take any notice. That's the way we solved it. Anne's going to tell me how they're going to solve it here.
Well, I think it's a fantastic point, Don, and so I want to take that one home with me. And I think we'll have to discuss it and think about it, because the type of guidance then around what makes a good case study is very important. But I was really reassured last year at the Clinical Trials Day, where ACTA, the Australian Clinical Trials Alliance, gives out awards for best clinical trials of the year, most of which turn out to be NHMRC funded. A number of those last year were actually trials that showed that doing something expensive was worse for the patient than doing something which is currently standard practice and possibly much less expensive. And there were terrific examples of that, and one hopes that they were sufficiently compelling that they will have been taken up. But I thought that was a great environment to promulgate the importance of what you could consider a negative trial.
Thank you. Just from the web, Ian Cameron has asked, to what extent is consumer engagement important for impact?
So to what extent does consumer engagement impact?
Important.
Is it important for impact, I think? Well, of course, it depends on the type of research, but we would argue that consumer engagement is important across the whole spectrum of research. But if you're working on transcription factors in a cell line, it's much harder to engage consumers with help to design that project. But then your institution or you as a group leader might want to think about how you engage publicly about that type of research. But of course, when you talk about clinical trials or cohort studies or many other types of research, then where there's a much more direct consumer and patient involvement, then it's really critical. But I think the challenge for us at NHMRC in thinking about how you put increased emphasis on consumer engagement into funding scheme guidelines or peer review guidelines is the very broad diversity of research we fund. So we struggle a little bit with that, but I think we need to keep working on it.
Yeah, I would say absolutely agree with Anne that in the UK we don't call it consumer engagement, we call it PPI, patient and public involvement, but this is a very big theme, and certainly if you're applying for an NIHR grant, which is the sort of applied end of the kind of stuff that your organisation funds, you have to now demonstrate consumer involvement, if you like, at every stage of the research cycle, including dissemination. They're theorising that there are, funnily enough, I'm just doing a systematic review on this, so I could talk for as long as you like about this subject. There are two ways in which the involvement of patients and the public gets theorised. One is in a sort of mechanical, rather Newtonian way, you know, that, for example, the patients can help you write the lay summaries type thing, and that will make sure that more people understand it. That's not wrong, but there is a more, if you like, critical social science perspective on consumer involvement, which is about democratizing research. It's about making sure that research priority setting is actually involving the end users of the research, which often means the patients who have that condition, etc., etc. But it is also about that critical questioning of the spending of public money and the ethics of research and all that kind of thing from an informed and critically engaged public. And I personally align very closely with that critical social science lens to say that it's actually a little bit more than just making sure you've got two people on the steering group and two people taking a bit of a look at the findings and that kind of thing. Nevertheless, even if that second approach is all you're doing, it's still a heck of a lot better than nothing.
Is there a question just in here? Oh, next.
Sorry.
Hi, my name's Lyndall Trevena. I'm academic GP at the University of Sydney. Thanks for the talks. I'd like to go back to the issue of changing practice that is something that's perhaps a negative finding or something that tells us we should be doing things in a different way. And my question to you is whether you have any examples that from the UK or thoughts from the NHMRC on how we might do that. It seems easier to implement something new or adopt a new or a novel test or treatment, but to stop doing something or to change the way we do it is far more difficult, particularly if there are disincentives in the system. Just to give you an example, I was in a meeting a couple of weeks ago where the evidence was put that shared care for following up with cancer survivors is cheaper if you do it with your GP rather than going back to hospitals for breast and colorectal cancer survivors in particular. The care is equivalent, and it's actually perhaps arguably, better for the patient, better patient satisfaction, but it certainly saves money. The nurses and the hospital administrators and oncologists in the room were terrified because their funding is tied to performance and numbers of patients through clinics. So people would lose their job. So that was a disincentive for them to actually change. So could you comment on that, the challenges of impact in that sort of environment?
Very, very interesting question. Actually, last week I was in Melbourne at La Trobe doing a workshop on disinvestment, and I hadn't thought of it as linking to research impact, but certainly of the 162 impact case studies that I looked at for that paper on the 2014 REF, one or two of them were about disinvestment decisions. I think, I'm just doing this from memory, but I think there was one about those super duper vacuum cleaners that if your kids got asthma, and then we used to say to the mum, go and invest $1,000 in this amazingly high-powered vacuum cleaner to get rid of all the dust. Actually, it doesn't make any difference. And I think I may have that one wrong, but I think there was a package of these whole things where they visited the home and they got rid of all the curtains and all that kind of thing. And it actually didn't make that much difference. But yeah, it was really, really hard to get people to come back from something that they'd already been patterned to do. And the example you give is just a brilliant example of it. If it's already routinized and it's already rewarded at organizational and policy level, and there's a payment thing tied to it, very, very difficult. Absolutely.
Yes.
So my name's Chris Roberts. I'm an academic GP too and contributor to the Cognitive Decline Partnership Centre. I guess my question was about education and in particular sort of research education. From the models that we've seen, are we able to say anything about the impact on impact of the kind of way that we train researchers of the future, either as sort of unidisciplinary researchers or increasingly for complex problems interdisciplinary researchers?
Yeah, thank you. It's a really important question because certainly I grew up in a time where I learned a very narrow form of biomedical research, always working in biomedical research labs, and at least in the early stages of my career. And so you just don't have that broader view and don't even think about asking the broader questions. So I think that a changing environment where there's more focus on reminding people to put their research into a much broader context, to have the discussions within your research group about what that broader context is going to be part of changing that scene. And I also realise that having funding agencies put value on certain things will be one of the drivers to do that. So we understand at NHMRC our power through impact measurement or anything else we do to have an influence on how people behave and therefore what they transmit to their PhD students in their early career. It's very important.
Yeah, I agree. One of the things I'm going to go back to at the University of Oxford is I was saying to Anne beforehand, I thought I would never, ever set up another master's program, but guess what? I am about to hopefully set up another master's program, and it's in translational health sciences. Because, not because I think a lot of people are going to do the whole course, but because actually to do a 1-week intensive course in some aspect of translational science, which is all the stuff we've been talking about really, it hopefully will give a boost to a researcher who has had, like I had, a very narrow doctoral training in lab science. I spun test tubes for 3 years, and it's a very great fun, but it didn't teach me the kind of skills that you need to achieve the kind of things we've been talking about.
It's a really interesting question, and perhaps now one from the people on the web. from Shanthi Ramanathan from HMRI in Newcastle. She asked, Dear Trish, thank you for your presentation. She's asking about the example you used about testing for Down syndrome. She says it was presented as an impact narrative following a linear model of impact, and she wonders if you might want to comment on the journey as a more iterative process or documenting the pathway to impact and lessons learned. Her question is, rather than selecting impact metrics versus impact narratives, can we use both paradigms to create a more nuanced approach?
Really, really important comment. I wrote a paper not too long ago. It wasn't an academic paper. It was called Stories or Numbers, or Stories and Numbers. The idea that the narrative is something that is data-free, or at least it only contains qualitative data, is a myth. All quantitative data, when it's being presented, is part of an implicit narrative. I can put up there, here's some data, and implicitly there's a story about where that data came from, what the data mean, etc., etc. This wonderful new science of infographics is a very good way of crafting a story around key numbers. The point about it is that a good impact case study not just contains numbers, because numbers are no good unless you can demonstrate that they're robust and auditable and verifiable and all that kind of thing. But I remember when I was working with people in the medical school I was working at in 2013, developing impact case studies. We said every single claim will be tied to an auditable and preferably quantifiable claim, because otherwise you've just got not much more than fiction. And actually Jonathan Grant at King's College London, who's done amazing work doing sort of automated analysis of impact, the 7,000 impact case studies from the REF. By the way, they're all online. You can just put UK REF 2014 impact case studies into Google and you can get a searchable database of these. What Jonathan's team demonstrated was not only did almost everybody put in good quantifiable data into their impact case studies, but that when they tried to verify those, they could. That in general, the academics did not lie. Of course, like on your CV, you present good stuff, but actually you don't fib. I mean, unless you're Carter Page or someone, you actually present it in a way that someone can verify. And that was, I think, more than anything else, the reason why they decided to use the same narrative version of the impact case study, because actually they were a very good way of pulling together a lot of different quantitative data. So yeah, the numbers as part of the story. Any comment? No? Okay.
A piece of good news for almost everybody today is the RGMS version 2. This is, I think, sort of a high moment in your presentation. But creating that new version does sound like you'll be able to do some of these more sensitive analysis that Trisha's referring to. Yeah, it's fantastic. Other questions? Okay, so we'll go you, and then Freddie will be the last.
Hi, I'm Dave Kennedy. I used to be an associate professor here in the Faculty of Health Sciences, but I'm going to ask a question that deals with the triple helix and my former job as executive director for the Atlantic Philanthropies here in Australia. Now, Ian, this is probably more towards you, and I'm so glad you're in that position and not me at NHMRC. The thing that I found when I was working at the top of universities and the top of government and the top of industry is that not only were there different narratives in the sense that they were all speaking different languages. There was academic, and then there was commercial, and then there was government. But when I looked deeper into it, a lot of the reasons why people couldn't talk to one another was because they couldn't translate because they were working under different performance management systems.
Yep.
And we have, it's just fact here in Australia that we punch above our weight in terms of output and research, etc. But I struggle when we're moving more towards translational. What can we do so that not only do people use a common language, but they even start to understand the other person's performance management? I mean, I've been in so many different meetings where I was trying to be the liaison across all three groups, and as soon as the other two groups left, the one that was remaining would start telling me what the other two were idiots. And it didn't matter whether you were coming from academics or commercial or government.
Well, I think, David, these are really important points, and I've seen them myself in a couple of different environments. I ran a cooperative research centre for vaccine technology for a few years, quite some time ago, and that was a semi-commercial collaboration between academic researchers and CSL and various licensing pharmaceutical companies around the world. And so I got to see there that different mindset in the commercial world of biotechnology compared with what people were trying to do in the lab. And I think structures like CRCs are incredibly important vehicles for training people to understand that other perspective and to get interested in it. One of the outcomes from our CRC, as for a number of others, was a cohort of PhD graduates who really had a foot in both camps and understood the language of the commercial world and the academic world, and many of whom then went on to make their careers in the commercial world but brought that heavy-duty academic background along with them. So I think these sorts of collaborative enterprises, and of course the partnership centres are another version of collaborative enterprise between end users and academic researchers, just incredibly powerful way for particularly younger researchers, students to grow up in an environment where they're exposed to that other perspective. In my role now, I see myself as, to some extent, a translator between the research world that I come from and the government world, which I'm still learning about, and obviously has its own drivers. But to be able to think from the perspective, as we all must, to try to understand the perspective of a Minister for Health and how different that is from an academic perspective, we do need to understand that. Most of the things that we measure and count and crow about are just self-serving from the point of view of a government minister. They want to know how we're going to save lives and save money and improve the health of the population. So again, just having the kinds of collaborative enterprises where people are exposed to these different viewpoints, I think is very, very powerful.
So Freddie, I think it's really hot in here, isn't it? The air conditioning is obviously a tender. So really quick question, a really quick answer.
Just the extent to which these matrices celebrate collaborations. A lot of these centres are all collaborative, and a lot of the leadership that comes out of there has come out of collaboration, standing on the shoulders of many, many other people.
It's affected by the heat.
It's the heat. A lot of the fellowship applications that we write look like ophthalmology reports. I did this and I did that and I did the other thing, forgetting all the other collaborators that you worked with. So is there a balance? Is there a way of measuring that?
Yes, a good question, Freddie. And is this something your committee's been considering?
Yeah, I mean, I do think this is a challenge, because if you're applying for something for your own salary, then you need to say that you did everything. But I think if we were thinking about impact case studies, most people, I think, will realise that it's very unlikely that one person has had the whole impact of the story. And so that means that the framework has to be sophisticated enough to appreciate the non-linearity, the fact that the attribution isn't going to be 100% to one person, and that that's still okay. And that's also important when we simply look at publication lists and need to get away from just considering the first and the last author, particularly as more and more papers have many, many authors, and each will have a different role, but we don't want to have a focus that's only on the so-called leader or the first author. So there are lots of challenges here, which we'll all continue to struggle with, I'm sure, over the coming years.
Well, look, thank you for a set of really interesting questions that started to unpack some of those complexities, and I think thank to both of you for just wonderful presentations that started this discussion, and I'm sure we'll want to continue it. I'd like to invite everybody to join us for some refreshments now, but before we do, can I ask you just to thank our speakers for